Matt Young, and I'm the president of IAOMT this year, and I appreciate the opportunity to be here and talk. Back in San Diego, someone walked up to me and said, I've been reading on the internet what you've been doing and some of the emails that I send out to a lot of the members, and just to get some feedback as to what's happening politically with mercury and fluoride and some of the other things. So they said, could you give a presentation to the next meeting about what you've been doing with OSHA? And I said, well, I can have a conversation and talk to you about what I've been doing, and it's not really a lecture. It's just kind of, it's been a really dynamic thing because it seems like every week or two things change. And so I've even got some updated information that has come out since I made my slides. So this is my contact information. You can get it off the slide later on via the office when you download it from the IAOMT website, or you can just Google my name and my website will come up. So it's pretty easy to find. Can you guys see the screen over here okay, where you're sitting? This is the wrong, I've added some slides since this was done, so I think we messed up something fair. Take a short break, guys. My apologies. I've changed my talk so many times and added a whole bunch of slides over the last couple of weeks that I want to make sure I had everything on here. There we go. Thanks. Perfect. Okay, so like I mentioned, this has changed quite a bit since I first started it, and from week to week I've added some extra slides. So I decided that Rick Shannon has cat pictures on his presentation, so I had to have some dog pictures on my presentation. And this is little Dixie Star. She's an English Bulldog, and she's from Fort Payne, Alabama. And this is the day we picked her up. This is she and my wife. She's about 8 months old at this point, and she saw me putting my luggage in my car the other day as I was leaving for the seminar, and she just gave me this look like, where are you going? And I'm lucky enough that the nurse who works at our veterinarian's office, she is my dog sitter. So if anything happens to the dog, she can call up the vet and say, guess what, Dr. Young's dog's sick. So I'm really lucky to have a good house sitter. And I basically kind of started my theory about what to do with this, bearing in mind what is our higher purpose. The first, I think, and most important purpose that we've got is safety in the workplace. And the reason why I highlight it so many times, when I had the opportunity to be with Robert Sherrick and the design team, we were standing outside and actually smoking a cigar, and he said, Matt, I don't understand this biologic dentistry stuff. What is this all about? I can't get my brain wrapped around it. And I said, well, we're all about biocompatibility. And he goes, oh, I don't understand that either. And he said, what else? And I said, well, we're about workplace safety. And he said, that's got to be your moniker, because you can talk about biologic dentistry, you can talk about biocompatibility, you can talk about the mouth-body connection, all this stuff, but when you start talking about safety, that's what the average Joe Blow who wants to know about biologic dentistry can wrap his brain around. So I think the biocompatibility is important too, the mouth-body connection, ethical communication, getting true informed consent from our patients, and then doing the public and professional education, and now protecting the environment. I think that's probably number 2 after safety, because that's really going to ring true with the average Joe on the street. So how did I get started on my agenda? And this is something that may be a little bit controversial, but I'm not sure how much you guys talk about this, Bill, in your Thursday basic stuff. But I think in order for us to walk the walk and talk the talk, we all ought to be compliant with OSHA law 1912, 1910, 1200. Now you can Google that. Just put in OSHA 1910 with the little comma thing and 1200 after that, and you'll get several hits about what that's all about. Okay. And so what I thought I'd do is I just start off by saying this is the law kind of, or the regulation basically in a nutshell. The first thing is that we need to be monitoring our offices on a scheduled basis by either a certified industrial hygienist or the dentist himself using the proper equipment. And we'll go over that here in just a minute. The workplace protection must be in place even if there's only a suspicion of exposure. Now, what does that mean? In my office, I bought an old dental practice, an old building, and the place where I have my private office used to be a dental office too. And when I redecorated, I didn't realize, well, maybe where these old dental chairs used to be 40 years ago, there might be some mercury in those rooms too. So I go and measure my private office in the bathroom and the kitchen where the girls hang out, and sometimes those rooms are a little bit high too. So we'll take the air cleaner back there and clean those rooms out a little bit if we have to. Engineering controls, we're going to talk about that too, where there's a possibility of higher risk. Monitoring the results and taking subsequent actions. And once you record your readings, you're supposed to keep your mercury vapor readings for 30 years in your OSHA handbook in your office, and it should be available to all the employees for inspection, or an OSHA inspector if they show up. Employees who are at risk must be educated about their risk for exposure, all the symptoms of mercury poisoning or toxicity. We're supposed to provide free medical testing and detoxification if it's suspected. And they have to be taught about the operation and maintenance of all protective gear. And something that I had heard about, I don't know if Dave Kennedy told me this or not, but I heard from somebody at some time, technically we should send our assistant or our hygienist to a physician and have the respirator fitted. And here's Dave, so he could probably answer this question. Are you supposed to get a consultation from a physician about the girls wearing the respirators? Aren't they supposed to get it? You don't have to? Okay. Okay. So monitoring, there's lots of different ways to do this. We talked about this at lunch a little bit with some of the people I was sitting with. I chose just to go ahead and buy my own Jerome because I knew I was going to be working at the dental school with some of these issues, and I knew that I want to be able to keep my own records and have it available and teach other people how to do it and that sort of thing. Now, these you can rent them. I think Jerome has a few they rent. If you just Google Jerome Mercury Analyzer, there'll be several industrial hygiene websites that come up, and you can call them and reserve one, and they'll send it to you. So they'll rent it to you for 3 or 4 days at a time. I think a rental probably runs about $150, $200. Wouldn't you say, Dave? In that range? Yeah, they do recondition them. The 405 will go down to 3 micrograms per cubic meter. It has an automatic function where you can mesh on little buttons here, and it'll sample the air every 2 minutes, every 3 minutes, every 4 minutes, whatever you want, and it will keep that into a little computer chip, and then you can hook your printer directly up to a printer port back here and print those readings out automatically if you want to. It does have the memory capacity, automatic function. You turn the machine on and you hit the button that says REGEN, that stands for regenerate, and there's a little gold foil inside the machine. And what that does is it heats up, it chases all the mercury atoms off the gold foil, and then it's ready to go. And basically what it does is sucks in a little bit of air through this tube, and the gold foil has a negative charge and the mercury has a positive charge, so those little mercury atoms stick onto the gold foil like fly paper. And what it does is it alters the electrical resistance of the gold, and the computer knows how much mercury it is, and you can either print it out or keep it in memory. And then the Jerome people, or the Arizona Instrument people, recommend yearly calibration. I haven't sent mine off. It's probably about a year overdue now, but it still seems to be working pretty good. This was the top of the line. I kind of just bought it along with some other computer stuff that I bought. I think it was about $12,500, $13,000, that range. So it wasn't cheap, but sure. I've even offered some of you guys in North Carolina, if you want to swing by and borrow mine. I haven't done that yet. Now, when I talked, I spent a month or two talking to all the technicians on the phone. They've invited me to come out to the factory and watch them being built and calibrate mine and show me how to do all the bells and whistles, which I haven't learned yet. I basically just read off the face of it and record it in my OSHA manual. It is, but it's not recommended for that. I think it makes a nice dog and pony show if you got someone walk in with a bunch of mercury fillings and you want to. I've tried a soda straw on this, and it does work. Just using a regular soda straw, and it helps. I've done some readings in the mouth. It helps if you warm a little bit of water underneath the cup and have them swish with it just to warm the amalgams up. You're going to get a higher reading if you do that. Yeah. If you have them swish with ice water, you'll have the opposite effect. So if you want to have a nice demonstration for the patient, it's nice. And if I have a really picky patient who's asking me 20, 30 questions about mercury as I'm putting the rubber dam on, I'll usually just whip this out and put it in the room and say, hey, I'm showing you that we're being safe here today. So it's a good reinforcement for the patient to know that the room's safe for them to occupy. Record keeping. I've written my own OSHA heavy metal chapter from my OSHA handbook, and I'm going to post that on the web for everybody so you can download it for your own offices if you want to. It basically stipulates, mercury is the most toxic non-radioactive element on the planet. You're exposed to it at work under these conditions while you're placing amalgam if you work for another dentist, while you're removing amalgam in my office, while you're removing amalgam from the back of the trap from the dental chair every week when it's cleaned out. You're exposed to it when you open up the autoclave. I think, 10, 20 micrograms? Yeah. So you put amalgam on your cord packer when you're doing a crown prep, and that amalgam is going to get heated up in the autoclave, and you go to open up the autoclave, and guess what? Psh, it's all going to come out of the autoclave too. So another good reason to jiggle your instruments, to scrub them off really good before you put them in there for the first place. I'm not sure what the frequency is for monitoring, but Dave can probably answer that. Every 30 days? Yeah. Okay, so every day, I guess, if you go by that. And then again, we teach all of our employees the different levels. I tell patients we do 7 layers of protection. We do the body cover for the clothing because we know that the mercury particles are about a nanometer in diameter. So even if you don't catch them in the suction, you're going to get some to fly on the patient's clothing. So we always use, I think we buy like 500 of these for $20. They're pretty cheap. Put the plastic coated drape, rubber dam, eye goggles. And I use Luma Block. Does anybody do bleaching out there? The Luma Block, the stuff in the syringe. And I syringe it between the tooth and the rubber dam to make sure it's got a good seal on it too. So that keeps you from getting that gray junk on the gingiva when you take it off. And then I got these from Smile Center or one of those dental materials people. It's basic. We call it the burqa. I tell people when I'm done, I'm going to stick your finger in some purple paint to show that you voted. But yeah, we call that the burqa. Patients get a little giggle off of that. And then by the time you put the air cleaner on it, then the only thing exposed should be just the patient's tooth. Now, engineering controls, again, the air cleaner. I usually turn it on a couple minutes before we get started and then leave it on for 5 or 6 minutes after we're done. Then when I'm ready to take the rubber dam off, then we turn it down a little bit. But we were in a hurry one day because I've only got one of these, and I really should have 2. And I just taken mercury out of one patient. I was getting ready to anesthetize the other room. And we moved this about 3 or 4 minutes after we were done. And then I just walked in with a Jerome just for the heck up and mashed on it. It was like 80. I was like, oh, my God. I should have left it in here a couple more minutes and keep the room a little bit cleaner. And this is an engineering control, too. Anybody know why? No carpet, right? We had 2 operatories in this hallway and then 3 in this hallway. And as I was walking back to my office, I would mash the button every now and then. And the hallway was pretty hot. It was sometimes 20 or 30, depending on how many people were walking up and down the hall. So when I was in San Diego last year, we ripped all the carpet out and put this bamboo flooring down. And patients just go gaga over bamboo, I'm telling you. They will go gaga because there's no trees damaged in putting Dr. Young's flooring. So like, wow. I can tell my friends about that. It's very low maintenance too. It's pre-finished. So adding to the conversation about this, we've got lots of different people that we can educate about, and some of the things we've been talking about on the internet and some of the conversations we've had with some of the groups, and most of you are in that group that I've communicated with, and that is, how can we educate the general public for them to put pressure on the traditional dentist to become mercury safe and follow these protocols? Talk to our patients every day. as I get them numb and I start putting on the protective gear, I use the word benefit a lot. The benefit for putting the rubber dam on your tooth is to keep it from swallowing the mercury. The benefit for me to put this Luma block around your tooth is because I want to reduce leakage into your mouth. The benefit of putting a saliva ejector in your mouth is to keep you from having mercury vapor. So every time I put something on the patient, I'm using the word benefit or a synonym for that, okay? And I don't know about you guys. I charge a hazmat fee for all this. And it's a sliding scale. It's about $85 for a single tooth filling, single surface. And we have that coded on our insurance program as a category 4, which is orthodontics. So the computer knows they're not going to pay a dime on taking the mercury out as far as the insurance goes. And then if I'm doing quadrant dentistry, it can be $200, $220. It depends upon how big the chunks are. And if the patient's a little bit hard to deal with, sometimes it's a little bit higher too. You have to factor for the extra 20 questions you get, while you're getting started. Time is money. The schools, we're going to talk about that a lot here in a little bit, dental schools. Regulatory agencies, again, you could talk to the state board probably till you're blue in the face and spend $15,000 on lawyers, but you're not going to make any progress there. And then the allopathic doctors as far as educating them about it. So how did I start my journey? I thought, well, I'll start at UNC Chapel Hill. And I plugged in Chapel Hill in Google, and I Googled it, and then I Googled mercury in dental school, and every synonym that I could think of. And what I found was University of North Carolina, Chapel Hill, Department of Environment, Health, and Safety. Okay, this is the industrial hygiene department of the whole university. And it says, mercury pollution is the most significant environmental toxin found in the United States. Wow, that's pretty cool, At the university, elemental mercury is the most commonly spilled chemical on campus. Wow, I really got excited when I read that. Over an 8-year period, roughly 70% of all chemical spill cleanup has involved mercury. So they're spending a lot of time thinking about this already before I even found them, okay? Improper disposal of or unrecognized or unreported releases of mercury are a threat to the community and can lead to significant regulatory consequences for the university. Uh-oh. If they get caught, they're going to be in deep doo-doo. UNC Chapel Hill has an obligation under federal and state regulations and to the community to reduce the volume and quantity of mercury generated on campus. Wow, if they use composite instead of amalgam, they could even do better, couldn't they? Ding, ding, ding. The little lights kept going off in my head. And really, I hadn't read this in detail. I had it on my computer, and I thought, well, the more I read that, the better I like it. So that they had what they call, they had even had a zero mercury website that said, we have zero tolerance for mercury in all university buildings, except for the dental school. If you work in the dental school, we don't have any idea how much mercury is in there. Right. So the scope, the Department of Environmental Health and Safety is responsible for properly disposing of mercury waste from laboratories and educating the campus about alternatives. And the policy, all non-essential uses of elemental mercury are to be eliminated from campus laboratories by December 2009. So this was a publication a couple of years ago. Non-compliance, the Department of will begin citing mercury reduction elimination non-compliance during the Collaborative Laboratory Inspection Program, CLIP, inspections in 2010. So it got to be late 2010, I started increasing my phone calls and, who's doing this, who's in charge of this, who's doing the testing, who's doing the educating. And then I found out that they have what they call the Department of Environment, Health, and Safety will also serve to oversee the department and implementation of mercury educational materials with the help of the Office of Sustainability. So then I found out they were a whole different group that was specifically organized to train employees about what happens if you breathe mercury at work. So I started emailing them all over and sending them a lot of the same information. I understand you're supposed to be helping the dental assistants of the dental school learn about mercury vapor and the dangers of breathing it every day. And have you done that? No, not yet. It's not on our schedule yet. That's what I heard. I then started thinking more about the hierarchy of the university. I emailed the chancellor, who happens to be Dr. Holden Thorpe. He has his PhD in chemistry. And I emailed him several times. What can you tell me about the dental school, monitoring of mercury vapor in the clinics and such? The environmental division was the group I just talked about. The Department of Sustainability, I emailed them several times. And then while I was emailing these three guys, one of the attorneys at the university got a copy of all my emails and sent me an email. Dr. Young, I understand you're interested in getting some mercury vapor readings in the dental school. I'll get that to you in about 3 or 4 months. I just have to look through the records and find them, and I'll email them to you, Dr. Young, don't worry. Okay. And in the meantime, I'd already emailed the deans and the head dean, the head of the clinics, the head of the OSHA training program within the dental school, and a few individual staff and instructors. I even found out the email address of the supervisor who was in charge of all the assistants, the dental assistants, because I thought if I maybe educated her about it, then she might think, some of the people underneath me might be a risk of exposure, but I didn't hear back from her. So the first person I found was this Janet Phillips. She's just one of the industrial hygienists, works on campus. Had a conversation with her on the phone. And then after I talked to her, I just emailed her, I'd like to see the mercury vapor hygiene monitoring records for all dental clinics which handle mercury within the dental school. And she emailed me back about a month later, we don't have any readings at all. We've never gone in the dental school. We have no idea how much mercury's in there. Well, from then on, I've been asking questions that I already knew the answer to. Okay? So the next logical step was I worked my way up through the legal department, found out who the attorney was who was in charge of federal compliance and who was responsible under the Freedom of Information Act to release those records to me. And she was the one who told me, well, I can get that to you. She was confident that they had it, but I knew they didn't. So what it's all come down to is I've had, basically I went to Legacy and the design team, and I realized that some of my initial emails, which were rather threatening and kind of forceful and demanding, they weren't making me any progress. So I called up the dean, and the dean said, I went through all your emails, Dr. Young, and you seemed rather forceful, and you didn't have he's mentioned my tone of voice in my emails, and I said, I'm really kind of beyond that. I've gone through some change of heart, and I really want to work with the dental school to increase the safety of the dental school. And I think we can all agree, even the ones who are working in the dental school, that if exposure to mercury vapor with your employees is a danger, then that needs to be recognized. I'll be willing to help you set up protocols, measure the clinics, educate the employees, whatever it takes. But I told him, I said, I'm really interested in helping to make the school safer. And he said, well, Dr. Young, I really appreciate your conversation. I do know the lady who's the supervisor in charge of the industrial hygiene department. I know she's a real go-getter when it comes to making the laboratory safe for everybody. And she said, I'm sure she'll work with you. And they have a new dean at UNC who was hired. Her name's on the top of my head, but I can't remember it. But she's due to come in July the 1st of this year. And I've already emailed her, and I have a tentative meeting with them in the summer to get together with everybody. And I'm going to probably bug some of you guys for some help. And Bill's already volunteered to come with me to do we're going to do a little elevator speech, Mercury 101, the dangers of it. I'll do a quick review about the OSHA law, and then we'll see what happens after that. Okay. We'll make sure your pictures work. And all this time I was in conversations with the local state OSHA people, and I talked to Dr. Ed Getty is his name. He's the head officer of OSHA at the North Carolina Department of Labor, and he's what they call the heavy metals officer for OSHA. And every time I emailed someone at the dental school or in the industrial hygiene department, I said, if I was working in the fluorescent light bulb industry, or if I was working in the phosphate fertilizer plant, or if I was working, in the little switches in the shoes that light up with mercury in them, I said, if my employees were breathing this, I'd have to keep records and close the plant down if they got exposed. But since I'm in the dental industry, I guess nobody pays attention to dentists or assistants. And he's like, I know, this probably should be done. And I said, well, can I complain to OSHA directly? And he said, no, you have to be a dental employee and you have to file a formal complaint. But we're not allowed to enforce a regulation unless we have a complaint from an employee. Mm-hmm. Right. You could, but then you'd be suing yourself. Yeah, that's true. But they would just use the readings. They would send an industrial hygienist to your office and measure, but then they would just issue a warning to clean your office up. It wouldn't go back to the university and force them to. Sure. That's possible. Yeah, yeah. Because you're going to find some in your office no matter how clean it is. Yeah. Then I talked to Dr. Getty a little bit more and said, well, how about the state certified OSHA instructor? Because there's two different kinds. There's the ones that OSHA trains that they send out to teach courses, and then they have these independent guys and gals who learn about all the laws. They go through a certain amount of training, and then OSHA says, okay, now you can go teach an OSHA course. I don't know about you guys, but I get like 4 inches of junk mail every day. I mean, about this stuff. And you come to my OSHA course and come to my bloodborne pathogen course and all this stuff. And so I tried calling some of the official OSHA people, and they said, well, we don't teach that, and we know it's probably a regulation for OSHA, but since no one asked us to come teach them about heavy metals, we don't mess with it too much. And finally I found this lady by the name of Ann Bachman. She runs a Southeastern OSHA company, and she does education in Tennessee, North Carolina, South Carolina, and Georgia with about 3,000 different dentists. And I said, what can you tell me about your didactic course in mercury vapor? And she said, we don't have one. And I said, you know, there's an OSHA law in 1910, 1200 that demands that the patients can't, or the employees can't breathe more than 50 micrograms per cubic meter in an 8-hour day or 100 micrograms in a single exposure. And she's like, there is? I didn't know that. So I wrote a letter, and I think I emailed that to everybody. I wrote a letter to her, and she publishes a monthly newsletter, and my letter got published in her newsletter. So it went out to about 3,000 dentists in the Southeast. And then she said, again, you know, people call us up to come in and teach them about the blood and the HIV and what happens if you get stuck by a needle, but people don't call us up asking us about mercury. But if you'll write me a chapter for my OSHA handbook that we pass out on mercury vapor, I'll put it in the OSHA handbook. And I'm going to go to IAOMT to learn how to do this safely on every page if I can. So that's the plan, is to slowly whittle away at some of these independent contractors. And I think every time I get a thing with OSHA now that comes across my desk, I send them the same email. You know, are you teaching heavy metals? Do you have this as part of your OSHA handbook? Is this something you're teaching the people that are signing up for your courses? And I've gotten 3 or 4 other responses back, but no definite promises yet for other than the one that I've already got. So this is basically kind of saying the same thing. There's OSHA training bulletins that come out for all these courses. Contact the trainers directly, and I would just encourage everybody just to do a stock letter on your laptop or your computer at work, and they always have a contact on their website or at the bottom of the brochure who to contact, and just shoot them the email. You know, what are you teaching about mercury vapor? Offer to write articles for their newsletters. Offer to compose chapters for the OSHA handbooks, which can be distributed to their clients, and then offer your professional expertise if they happen to have a course where they've got someone who is interested in doing something. So then I got to thinking, rather than hit one dental school at a time, why not hit all 52 or 56 or however many there are in the Northeast and in Canada? So I went to this website, the American Dental Education Association. Has anybody ever heard of these folks? I didn't until I looked it up. They have about 5 to 6 meetings a year. They have one meeting with just the dental deans in all the dental schools in the United States and Canada. Then they have their annual meeting, and this year it's March the 12th through the 15th this year. It's in San Diego, and I think they've reserved pretty much the whole San Diego Exposition Center there and I downloaded their brochure for their meeting this year. It's 72 pages long. I mean, they're giving courses on, how to have a balanced geographic dental class. Are we ethnically, are we balanced with our dental classes, and are we teaching class 4 composites correctly? And there was even a talk on a class 1 amalgam this year in the program. How to do a class 1 amalgam, we all learned that freshman year. And so I think for the big meetings, they have at least all the deans show up. They probably have the heads of each of the departments, and perio, endo, prosthodontics, everything shows up, and then they go to their each individual courses. But it's a very exhaustive program that they do every year. Next year, I think they're doing one in Orlando, and April 1st, I contacted the person who was in charge of programming there for speakers, and April 1st, they have an open place on the internet where you can apply to be a speaker. So I plan on applying to be a speaker to go talk about green dentistry, how to make the dental schools more environmentally safe and sound, and how to protect your employees from mercury vapor. So we'll see if they bite at the bait or not. I may not say I'm from IAOMT. I might just leave that out on purpose just to see if it makes a difference or not. But April 1st is when they come up. So to kind of summarize, working with local dental schools works the best when they're contacted with integrity, responsibility, accountability, and a proactive communication. When I was kind of a hard ass and giving them a hard time and saying, you may have to shut down the clinics if they're poisonous, I didn't get anywhere. But when I communicated with a more open and helpful tone to my voice, it made a huge difference. Communicated with independent OSHA instructors, and they seem to be really sincere about making their offices safer. They're not tied at the hip with OSHA like the way the official OSHA instructors are. So again, look to your junk mail every day. When you get these little OSHA courses, shoot them an email. And we might be surprised. We may have some of these people say, hey, come and give a 15-minute talk about mercury vapor and talk to the people who are coming to the course this time. Offer your services to do that. And that's it. I appreciate it. And this is a small group, and we still got some time, so if you want to ask some questions here, let's just go ahead. Boyd, go ahead. Right. Mm-hmm.
Get this thing fixed for you, then I'll have another hour to do stuff, like that.
Mm-hmm. Sure. Oh, yeah. Sure. That's a great idea. As a matter of fact, when I contacted the supervisor, her name is Mary Beth Koza, at the industrial hygiene, I said, Senator Kucinich and the EPA is considering mandatory use of mercury separators on all dental clinics. I said, what can you tell me about that? And she said, well, I know we have one in one clinic, and I think total there's 325 dental chairs in the dental school, something like that. So they've got one for 325 chairs. There's no way that's compliant. Yes, John?
About 16 years ago, I was at Charlotte Airport and picked up the Raleigh newspaper. And there was an article in there from the North Carolina Department of Health where they were talking about the great concern about the amount of mercury coming out of dental offices going into the water in the water supply. And their recommendation was that dentists should find a way to reclaim that mercury and put it back in the mouths of their patients so it wouldn't contaminate the water supply.
All right. That's a great idea. Dave Kennedy.
Yeah, I have two other things so you don't look like Betty used to call this the international. Betty used to call this the International Academy of Oral Mercury Toxicity. So to spread it out, the and other exposures that they're supposed to be protecting against, and I'll bet you a nickel to a dollar they're not, is the uranium that's in the porcelains. So when you're grinding a porcelain, then there are already recorded deaths from cancers from the nickel in grinding on stainless steel crowns and nickel crowns. So talk about OSHA in general protecting employees from respiratory toxins that are regulated and often used in dentistry, such as the carcinogen. Nickel was the first metal ever regulated in this country, and it was a law passed by Congress that said an individual couldn't make stainless steel because he was killing so many of his employees. So anyway, that was 1900.
That's a good point. I don't know if most everybody in here probably knows this, but Rexilium-3 is one of the #1 crown and bridge materials in the country, and it's 49% nickel. And John sends me patients that are high in nickel, and we replace those with Cerac, and the nickel goes down.
I don't know how much it's used anymore, but there was quite a few studies on the use of beryllium in partials and the incidence of nasal cancer being really, really high in lab people.
That makes sense too. And getting back to the uranium part with the porcelain, what a lot of the labs are doing is they'll get your impression, they'll pour it up and they'll trim it, and then they'll send it to a lab in China and in Hong Kong, and then they're stacking the porcelain and paying the people probably $2 an hour to do that, and then they ship it back to the lab, and then you get it. So you really never know unless you ask.
And, according to the ADA, 6.5 tons of mercury are released from the dental office in effluent, and I have to imagine that number is an extremely low estimate. Maybe we could add up, do a survey of offices. You said, did they measure? Oh, Boyd left already. Did they measure how much was coming out of the dental school, and then we could average it over several? See, that would be the number to know. Maybe there's 100 tons coming out into waste effluent. We don't know, because I can't imagine their number's correct.
I know for a fact we had a dentist in Tuxedo, North Carolina, which is just south of Hendersonville, and this fellow's dental office was on the Green River, and the Green River is one of the big rivers that the kayakers and the boaters take. And just for the heck of it, some of the kayakers were measuring the water as they were going down the river, and they were taking little scoops and screwing the tops on them. And when they got to a certain part of the river, they sent all that in to test, and one of it spiked on mercury in one particular spot, and they were smart enough to write down where they took the water samples, and they looked across the field, and there's a dental office within about 500 yards of the creek or the Green River. And they called the EPA, and the EPA came out and inspected it, and he had a septic tank with a leaking drain field headed out towards the Green River, and they found mercury coming out of his drain field, and I think it ended up costing him about $70,000 to clean it up, and fines and stuff. So that's just one dental office in North Carolina. You can imagine what's probably really happening everywhere else. Oh no, I'm sure it didn't make it in the ADA news. Sure. So, yeah, if it doesn't work with the mercury vapor in the clinics, then I think the next place to go after them is the affluent water. Right. Right. That was a point that I made with the supervisor, the assistants. I said, I know you have some janitorial staff who walks through the clinics every night who dumps those traps, and I know they're probably just dumping into a plastic bag and throwing it away. So if they don't have proper protection when they're cleaning those traps out at night, they need to know about it. So it starts from the beginning when it's mixed to the point where it goes down the sewer. So we have lots of avenues we can look at in the future. So thanks, Dave. That's a good idea. Anybody else? Okay. Thank you very much.